Good afternoon. Today is Tuesday, August 18th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. We are now in our 22nd week of dealing with coronavirus in Oswego County. As of this afternoon, our County Health Department has received 32,312 test results. Since March 22nd, we've had a total of 277 cases of COVID-19. We're very grateful that most of the people have recovered. Sadly, we have lost 4 residents to the virus. We currently still have active cases, and we know that COVID is still spreading in the community. Diane will talk more about this in a few minutes. Our goal, and the goal of the Central New York Regional Control Room, is to keep our residents safe and healthy, and to reopen our economy in a responsible manner to reduce the risk of spreading the virus. We continue to follow new developments and advocate for our residents and businesses and the types of activities that New York State is allowing. Schools will be opening soon. Parents and school districts have been developing their plans and procedures for the safe and responsible education of our children. Our County Health Department has been working closely with local school districts as well as SUNY Oswego on their reopening plans. As of yesterday, bowling alleys are now allowed to reopen at a 50% maximum occupancy. There are strict safety protocols in place. Every other lane must be closed, and face coverings and social distancing are required at all times. Customers need to stay with their group at their assigned lane, and equipment must be cleaned and disinfected after each use. The governor announced yesterday that gyms and fitness centers will be allowed to reopen starting next Monday, August 24th. Again, there are many procedures in place that make this a safe experience for customers and employees. Our County Health Department will be responsible for inspecting fitness center facilities to make sure they are adhering to the State Department of Health guidelines. Gyms and fitness centers will have a 33% capacity limit, and face coverings will be required. Customers must remain at least 6 feet apart, and the facilities must have appropriate ventilating systems. The state guidelines for these and other activities are posted at forward.newyork.gov. I encourage you to read the guidelines for any activity you are planning. As with other phases of reopening, business owners are responsible for reading the guidelines and developing a reopening plan. The group gathering guidelines have put a tremendous burden on people who had scheduled their weddings, conferences, and other events. The hospitality industry that we are so proud of has suffered significantly as a result. Last week, a federal judge ruled that wedding receptions could take place in venues if they follow the 50% capacity required for residents. However, the governor and the state health commissioner disagree with the federal court ruling. We hope to have a definitive answer very soon, and we will keep you informed on these important developments. And now Diane will report on the latest testing results.
Thank you, Mr. Chairman. As Chairman Weatherup mentioned last week, through our case investigations, the County Health Department found a cluster of cases associated with employees at Rabies ACE Home Center in Oswego. Members of the public who visited the store between August 5th and August 13th may have been exposed to COVID-19. We ask customers to monitor their health and watch for COVID-19 symptoms such as fever, cough, loss of taste or smell, shortness of breath, and gastrointestinal illness. These symptoms can show up during the 14-day period after a possible exposure. Our department is working closely with the New York State Department of Health and Rabies Home Center. The store is following our guidance and maintaining disinfecting and cleaning protocols. Last Friday, we also reported a cluster of cases reported to people attending a sports camp outside the county. Our staff in the Preventive Services Division of the Health Department have identified close contacts and will continue to monitor them. This is an important reminder that all of us need to take personal responsibility for preventing the spread of COVID-19 virus. Our investigations have often been complicated by the number of social gatherings that people are attending this summer. One infected individual can expose several others to COVID-19. This means continued spread with many more people under mandatory isolation or quarantine. It's imperative that people practice physical distancing and wear a face covering when they can't maintain a 6-foot space between them. As of this afternoon, we have had 32,312 COVID tests performed on county residents. We have 277 positive test results. We have 19 active cases of COVID-19. We have 254 residents that have recovered. We have 4 deaths related to COVID, and we've received 31,825 negative test results. Currently, we have 103 residents in mandatory quarantine or isolation. Thank you.
Thank you, Diane. Today we released the last in a series of 4 community videos that were created by a partnership of agencies in Oswego County. We started this project a few months ago to inspire hope and confidence in county residents during the COVID-19 pandemic. The theme of today's video is perseverance. The video uses images of places and people across the county to show how Oswego County residents have persevered over hardship and overcome challenges throughout our history and before COVID-19. Thank you to our partners, the County of Oswego IDA, Operation Oswego County, Oswego Health, SUNY Oswego, and the County Department of Community Development, Tourism, and Planning for your vision and leadership in creating the series. And to thank you to Step One Creative and Kyle Ridlon Productions for your creativity and energy overseeing the project. We share a common goal of creating a strong community despite the hardships of coronavirus. Thank you as always for your cooperation. It is making a difference.